We appreciate that after neurological illness, injury or disease, the recovery of the arm and hand can be really difficult, and that's why we offer an upper limb rehabilitation programme. By incorporating specialist hands-on therapy, whether that be physiotherapy, OT or exercise therapy, with our robotics and VR equipment, our clients can have high repetition of practice to enable them to regain movements such as grasping and releasing, hand to mouth, which they need for eating and drinking, and also then more dexterous activities such as dressing themselves, tying their shoelaces. And when using your hands is so crucial to day-to-day life, we find that the upper limb rehab programme is really beneficial because it's often an area of therapy that is neglected.
The evidence seemed to be hinged around repetition combined with sort of activity for the mind, so make it interesting. It's not boring activity, it's something that stimulates the brain.
What's interesting as well is that they encouraged me to use my arm as well as walking, whereas before I was told one or the other. So I came here and it was more than 18 months and I've managed to use all the equipment and got my arm better and moving a lot better. So it definitely works.
We have the Amadeo, which is a hand robotics, which enables us to do high repetitions, opening and closing the hand to get the best possible outcome for hand function. The Diego is an upper limb robotics device that helps with recovering arm function and shoulder function, and uniquely it's the only robotic device on the market that does both arms at the same time. The Miro is a big interactive screen that patients can push and pull on the device and do fun and interactive games, and uniquely it also helps with cognitive training, which is helping develop your thinking skills and your planning and your processing, or visual scanning, which is really important for day-to-day activities. The Pablo is probably the most versatile device. It's a series of sensors that can be attached to any part of the body, and the patient can drive computer games with any task that the physiotherapist wants them to achieve.
The whole environment, just seeing all the machines and things is good, and certainly the intensity on offer ticks all the boxes in the books and things. With Motion Rehab, I've got a good plan in place for the days and months to come.
I had to have my mother even feed me at one point because none of my hands had the ability to remember how to grab a fork or even move my arms to my mouth to feed myself. And now I finally get to live at my own house. I live there all by myself, and it's all because of Motion Rehab.
The clinic here at Motion Rehab is unique because we fully integrate the technology into our rehabilitation programs. Patients don't come and just try a little bit of equipment, it's an integral part of their rehabilitation program. If you're interested in an appointment and an assessment for the intensive rehab program at Motion Rehab, we accept self-referrals. You can contact us via the website or our telephone number. We accept referrals from GPs, consultants, and we will take national and international referrals.